All right, let's talk about gingivitis. It seems so simple, right? But our understanding of it has been completely turned on its head. In this breakdown, we are diving into a new perspective from Dr. Leonardo Trombelli, and we're going to take a journey from the old-school plaque story of the past to the data-driven, personalized future of patient care. This one sentence, it really captures the stakes perfectly. Sure, gingivitis is reversible, but it's our only real window of opportunity to stop the irreversible damage of periodontitis. It is the critical line in the sand, and that's exactly why we have to get our approach right.
Okay, so to really appreciate where we are now, you've got to look back at where we've been. For the longest time, the story of gingivitis was, well, really simple. But as you're about to see, the plot has definitely thickened.
Back in the 1960s, the experimental gingivitis model was a huge deal. It gave us this simple straight-line equation: plaque causes gingivitis. Easy enough. But, clinicians knew the reality in the chair was way more complicated. By the 2000s, the research finally caught up, and the focus shifted from just the bacteria to the patient themselves, asking the question, why do different people react so differently to the same amount of plaque?
And this was the big shift, the real game changer. We went from a purely plaque-centric view, where the only answer was, brush better, to a much smarter, host-modulated understanding. We finally had a way to explain why some patients with barely any plaque have fiery red gums, while others with heavy plaque seem totally fine. It's all about that unique host response.
So what is this host response anyway? It's not just some fuzzy concept. Research has actually pinpointed real, biological drivers. We're talking about genetic factors like IL-1 polymorphisms and specific inflammatory biomarkers that we can actually measure. This is the science that finally explains those stable high and low responder types that we all see in our clinics every single day.
So how does all this new science actually change what we do chairside? Well, that's where the 2017 World Workshop comes in. It gave us a standardized playbook, a clear, unified language for diagnosing gingivitis. This workshop provided a super clear, universal case definition. The criteria are pretty simple. You see inflammation, you've got probing depths of 3 millimeters or less, and, this is the big one, absolutely no clinical attachment loss. And this definition works whether the patient has a totally healthy periodontium or one that's reduced but stable.
And here it is, the objective threshold, 10%. If a patient has bleeding on probing at 10% or more of their sites, boom, they have gingivitis. This number is so important because it's simple, it's reproducible, and it just takes the guesswork out of making the diagnosis.
So once we've identified a case, we classify how widespread it is. We call it localized gingivitis if there's bleeding at 10 to 30% of sites. But if it's anything over 30%, it gets classified as generalized. This just helps us quantify that inflammatory burden and really tailor our treatment.
Today we understand that gingivitis is so much bigger than just the gums. Of course, it's our #1 tool for preventing periodontitis. But we also know it's linked to systemic inflammation and that it genuinely impacts a patient's quality of life. This makes managing it a massive opportunity for real, meaningful patient education.
Now, let's look ahead, because the future is incredibly exciting. Technology is about to flip the script on how we manage this, moving us from being reactive to being totally proactive, and using data to give truly personalized care. Just imagine moving beyond the subjectivity of bleeding on probing. Digital scanners with colorimetric analysis can give us an objective, standardized way to measure inflammation just based on gingival color. This means reliable, reproducible data visit after visit, no matter which clinician is doing the exam.
And it's a similar idea with automated 3D plaque mapping. It gives us examiner-independent measurements, which is great. But its real power, it's as an education tool. We can literally show patients a map of their own mouth and say, see this? This is exactly where we need to focus. Now that's a game changer for patient conversations.
But the ultimate goal is to put it all together. Machine learning algorithms will be able to take in all this data, the scans, salivary biomarkers, genetic info, and create a personalized risk score for each patient. We'll be able to predict their disease trajectory and step in way, way earlier. So this is what the patient journey is going to look like. It's not about reactive visits anymore. It's a continuous cycle of proactive care. We capture the data, AI gives us the analysis, we deliver a completely tailored intervention plan, and then we monitor. We're preventing problems before they can even start.
Okay, so after looking at the past, present, and the pretty exciting future, what are the key takeaways? What can you apply in your clinic right now?
Let's translate all these insights into direct, actionable strategies. We can break it down into 3 key areas: your clinical decision-making, your treatment planning, and your overall patient care.
First, let's sharpen that clinical decision-making. Start actively identifying those high-responder patients in your chair. In other ones, ranging inflammation but not a lot of plaque. Use that Bob score as a powerful visual tool for education. And always position gingivitis management as the absolute primary way to prevent periodontitis.
Next up, your treatment plans. It's time to shift the focus from just plaque control to actually managing the individual's host response. This is what allows you to truly personalize things like recall intervals and hygiene recommendations. And to make sure it all sticks, use tools like motivational interviewing to really boost that patient buy-in.
And finally, to elevate your patient care, you've got to connect the dots for them. Clearly explain the link between the inflammation in their mouth and their overall systemic health. When you frame treatment as a benefit to their total well-being, not just their teeth, you build incredible value and start getting them excited for this data-driven future.
This evolution gives us an amazing opportunity to move beyond just treating disease and toward promoting personalized, proactive wellness for our patients. So the real question is, how will you take these insights and use them to shape the future of oral health in your practice tomorrow?